weeks last night. Excited, nervous, wanting to throw up, all that stuff. But no, I mean, I know I got to do this.
Everything you're going through is totally normal. I'd be worried if you weren't nervous. It's a major step.
Right.
But is there anything I can answer for you to help put your mind at ease?
No, I think I'm doing okay. I just my mind goes back to reverting back to last year when I had all that stuff here. Now I know it's the stomach area versus everything else. Like the gas pains are coming out. Like I know I gotta walk and all that stuff.
Yeah.
How bad is that pain coming out?
It varies. The surgical pain is not that profound, but the gas pain, the meds don't really do a lot for it. It's a physiologic thing. You put carbon dioxide in there, so your body's going to absorb it and you're going to breathe it out.
Okay.
As you move around and you exercise more, you increase your respiratory rate, which is how it gets out.
Okay.
But this is why I keep you in the hospital overnight.
Okay.
So you get stronger pain medicine. It's stronger than the pills.
Okay.
You'll be on IV stuff. You'll be on IV stuff for nausea.
Okay.
So that's going to help all of that. By tomorrow, you'll feel a lot better.
Okay.
But I won't lie to you, tonight might be a little bit uncomfortable.
Yeah. No, I appreciate that.
Then
other
as
than
far as like the liquids, like is it just limited to broth or is there
Broth, jello, juice, water, clear proteins, sugar-free Gatorade, that
Okay.
kind of thing for the first week.
Okay.
Yeah.
Okay.
Because I'm actually down 26 pounds since I saw you at the hospital or
Yeah.
at your office.
Yeah.
So it's at first like I was having headaches like crazy
Yeah.
because it's detoxing and caffeine and all
Yeah.
that stuff. But at once like that every hour that you recommend, it wasn't. You gotta get used to it.
Yeah.
You miss certain things.
Right. Yeah.
I want to chew on a desk or something like that, but I mean overall it wasn't that bad, and I'm like, what if I don't need the surgery? What if I could keep just doing that? And then I'm like, yeah, but knowing me, I'll end up.
Well, you can't stay on a liquid diet like this,
Yeah.
for any prolonged period of time. It's your body's not designed for that.
Right.
I have had people like say I'm doing great on the PreOp diet, or I've done great on the diet, and I'd like to see how far this takes me, and that's totally fine.
Yeah.
Is that where you kind of?
No,
Okay.
because looking at my history, because I've tracked my weight for the last 5 years, it's been this, and I can do anything for 2-3 weeks.
Right.
That was my nerve, that was kind of my thought pattern was like, oh, that'd be great, and then once I go to a birthday party, forget it.
Sure.
You have that cheat day, it's like, forget it,
Yeah.
that's all out the window.
Yeah.
But I know that this is saving my life,
Yeah.
and I know that, what involves in it, and I'm the type of person I have to be strict.
Yeah.
Or you give me any wiggle room and forget it.
Well, I'm glad you brought up cheat day. So I'm not a fan of cheat day. I'm a fan of moderation every day. So don't have one day where you go crazy, but if
Yeah.
there's something you like, have it a couple times for the week. So have a bite of just say cake or ice cream, a couple times for the week. Don't cut it out because you gotta enjoy yourself too.
Right.
But don't starve yourself all week and then go crazy one day. That's counterproductive.
That's good advice.
That's
Yeah.
true. That's true.
All right.
Other than that, I'm ready. I got the book that I'll be reading up in the hospital. I'll get to familiarize the post-op now. We'll call
Okay.
that. And see what happens.
I think you're in good shape.
Man, I appreciate it.
My best patients.
Oh, stop. You say that to all you.
No, I don't. Tell people I've told somebody you're one of my worst patients. You never listen to me ever. You're the opposite. You actually listen.
I'm trying.
You're gonna get great results.
I know it's gonna be
Amen.
a change.
You're gonna have you sliding the bases and stuff. So.
Sweet, that's what I'm talking about. Oh, speaking of, how long after can I swing a bat? Because the 18th of January, we start practice.
You can swing that bat by then, yeah.
Yeah.
Absolutely. About a week or two after surgery, you're pretty much fully healed up because it's laparoscopic.
Yeah.
A lot of it is based on your comfort level. So if you're swinging or you're doing certain things and you're getting pain, then you do it. Take it a little slower.
Okay.
But there's not really a lot of damage
All
you can do
right,
after a
cool.
couple weeks with stuff like that.
Okay. And how about like flipping tires? Like I know that's a little more
That one is about
aggressive.
4 weeks out, yeah.
Okay.
So any
All right.
major lifting or any major core involvement,
Yeah.
I would say 4 to 6 weeks.
Okay.
All right, because the worst thing that'll happen is you pop the inside stitches, you get a hernia, and me and you are having this conversation about fixing a hernia in a few months.
Oh.
Yeah, so just to avoid that, you
Yeah.
know, extra week or so. But you can start cardiovascular exercise and light aerobic exercises like that within 2 weeks.
Oh, okay. Oh, wow. Cool. That sounds good. All right, I'm ready now.
Now, I sent some Med Street Pharmacy yesterday. Did you get them?
No, I
You
didn't
can
know
just
you
double
did.
check. They should be there.
Okay.
Percocet for pain, 2 things for nausea,
Okay.
and 1 for your stomach.
Okay.
All right.
Cool.
If they're not there, let me know. I can send them again.
Okay, yeah, because I know she's gonna leave. She can. It's on the way home, so
Sure.
she gotta check on the boys.
Okay.
So she can probably pick them up.
Sure. You want me to give you a call once we're done?
Yes.
All right. So
We're good?
make sure this is the right number here.
Yeah. Thanks, guys.